We have to find real solutions, and this is Bending the Trend. Hello, and welcome back to Bending the Trend with your host, Norm Volsky. And today we are thrilled to be joined by Sherri Samuels-Fuerst. Sherri, welcome to Bending the Trend.
Hey, Norm, thanks for having me. Great to be here.
Yeah, really excited to have you, and thank you for these last couple decades of fighting rising healthcare costs along with us. You're a legend in the space, and for all of our viewers and listeners that aren't as familiar with Sherri, she is a past chair of the MBGH, Midwest Business Group on Health, and also ran the benefits department at Sargento Cheese Company for very, very many years. So thank you for joining, Sherri, and I can't wait to learn all the insights you have to share about how to bend that trend.
Oh, thanks again for having me, Norm.
Absolutely. Well, Sherri, first question I will ask is, in your experience at Sargento as well as MBGH, are there any vendors that you implemented that you would highly recommend that really helped you manage your benefits a lot better?
Great question, Norm. Well, first of all, before selecting any vendors, I'd really recommend having a solid healthcare strategy, one that's based on your organization's location, size, industry, and culture. What may work for one large company that's dispersed across the nation with high turnover may not work for a small, mid-size, or mid-size rural employer with tenured employees. After you've reviewed your data and set your strategy, making sure you're able to get vendors in your ecosystem that you really trust. True partners is really key.
Yep.
So while at Sargento, we had a very stable workforce and we're located in rural areas, and we had three primary pillars for healthcare strategy. Keep it easy, accessible, and affordable. Easy to understand and use, with solutions customized to our population's needs, personalized whenever possible. Accessible, removing all those barriers to getting care, making sure everyone can utilize the benefits. And of course, making it affordable, minimizing or removing any costs for both the participants and the plan. Number one solution that I would recommend to keep your workforce healthy would be an on-site health and wellness center, one that focuses on prevention and acute care needs. We
And
started
real quick, for a primary care on-site clinic,
Sure.
that is free for the employees to be able to take advantage of and access.
Absolutely. Free for the employees. And in ours, it was not only the employees, but it was the family members as well. And they didn't need to be on our medical plan.
Oh,
So
wow.
it was a benefit. It was one of the best benefits. We started ours really part-time in 2006, so 20 years ago this year. And we really let demand grow that expansion. The hours of operation, services provided, as well as brick and mortar. And we really do as much in our wellness center as possible, short of, I always say, short of surgeries and autopsies, of course.
Wow.
But after we started it, I had employees come up to me in the hallway who said, "This is the best benefit ever. Please don't ever take it away." And I don't
That's
know
an
about you,
amazing
but
feeling.
being in
Unbelievable.
HR, that's a gold nugget. You just don't get those very often. So we knew we had hit a home run there.
And
So
walk us through that crawl, walk, run strategy. I think so many people, when making a change, they think it's all or nothing. Either we don't do anything or we do it 100%. There's ways to kind of do it slowly and methodically. So how did you see demand increase, and how did you scale it over time? It sounds like it was a strategy you had conviction on, but you still, were
sure.
pretty conservative initially. And then you got more aggressive as you started to see more data pour in. That was a tremendous investment. And not only
Right.
financially, but also from a culture, from a, retention standpoint.
Absolutely. Well, we definitely started slow because we had reached out to the local healthcare system and said, if we're going to do this, we're going to do this with our local community providers, if you would. And of course, there aren't abundant providers in a rural area. So we started out with part-time nurse practitioner and a part-time physical therapist. And like I said before, we let demand grow the number of hours and then expanded the services beyond that.
Yep.
So when their schedules filled up, we knew it was time to start expanding. And
Yep.
the overwhelming positive responses that went all the way up through to the CEO, I mean, it was pretty obvious that this was a home run and we weren't going to take it away. So building out and getting more and then working with that healthcare system to get the providers more time, more providers. I think now we have, or they have, as I retired last year, they have at least 3 nurse practitioners, 4 nurse practitioners with different rotating schedules. They come in at 5 in the morning to handle our third shift. They stay until 4:30 in the afternoon. So it definitely is convenient, accessible for all of our individuals. Think about going to the doctor before you even go to work or go to school. Take your kid to the doctor before you go to school. That is just a game changer, right? So
And were employees able to go at any time during their shift, or did they have to schedule it either before or after?
no, they could go at any time during their shift. If they were, working, obviously, they'd go on their break. And so it was really located right on site. I mean, literally on site. We built it adjacent to the plant so that it was convenient for them to get in, but they didn't have to parade past HR to get there, so that it was more private and, HIPAA compliant and all of that. But definitely accessible anytime throughout the day. If it was work related, they could go on their shift to just keep them really at work. And they didn't have to leave to go to the doctor, then to come back. So definitely very, very accessible. So
Yeah, you made it easy on them,
absolutely.
to do it, remove all barriers. I completely love it. Is there any other clinical services you added? Like you add NPs, you add physical therapy. What other things did you add, in later years that
Sure.
just continue to bring more and more value to not only Sargento, but each employee?
Yeah, good question. So we added a lot of different services over the years. Phlebotomy was key, obviously, to saving a lot of money. I'm telling you, that is the number one thing that you can add when you're pulling labs at, pennies on the dollar. That is huge. So phlebotomy and all of the locations. We had a personal trainer that would come in and do plans for people. We had physical therapists. We had mental health resources. And then, of course, a medical director to help guide people through, and make sure that we were compliant with everything. So
Love it.
a very holistic, basically like a DPC, really, with augmented services around it. There were pharmacy on site. So pharmaceuticals for the most common pharmaceuticals, non-narcotics, of course. They could get their meds. The kid was diagnosed with an ear infection, needed antibiotic. Rather than go to Walmart and get it, then they could leave with it in hand and take care of kiddo at home. So very, very convenient.
I love it. Any other vendors that you put in that you'd recommend to others?
Well, the one vendor that I always say, and this is non-health and wellness center, but they worked very closely with our health and wellness center on a number of solutions. The one that I would recommend would be a transparent PBM.
Fantastic. Tell us about it.
Our transparent PBM, we worked with, I'll reveal the name afterwards, but a transparent PBM we sought after in 2010, excuse me. So about 16 years ago, well before any of the, hubbubaloo with regards to transparent PBMs or the top 3.
You were doing it before it was the thing to do. You're a trailblazer, Sherri.
That's for sure. We went there and we had the PBM help us with strategy, help us with designing programs in our on-site health and wellness center. We designed one called Smart Scripts program, where individuals, if they were compliant with all of their recommended, medical, whether it be visits, updates, treatments, protocols, we would have them get their medication for free. And that's a game changer for everybody, because if people are compliant on their medication and they're adherent to their medication, clearly the outcomes are going to be better.
Totally.
And the costs are lower, not only to the participant, but they're lower to the plan. So then therefore lower to the participant in the following year, right? In premium reductions and such. So clearly this PBM was lowest net cost. They definitely worked with us on any kind of formulary changes, making sure that we were using the lowest net cost. From a biologics perspective, they came to us about GLP-1s in 2020, well before, again, that tsunami hit, I'll call it. And they really were a really good partner, and still are today a really good partner. So much so, we went through numerous RFPs for TPAs and brokers, and changed TPAs and brokers over the last 16 years. And the pharmacy analysts would always say, stick with them, you've got a good deal. Now, how often does that happen?
Very rarely. Very rarely.
Yeah, and the majority of our employees were on a high deductible health plan. So having a PBM that focuses on that lowest net cost is key to making sure people can afford their medication, like I said, and be adherent to improving the outcomes. But I can honestly say Navitus Health Solutions was a true partner. They listened to us, they got to know our strategy, and they were really, really proactive, which is key. And trust is the number one commodity when it comes to vendors in your ecosystem.
Couldn't agree more. Trust is the most valuable resource in all of employee benefits, and it's rare. So,
Yeah.
love to hear that. So, talk to us about your on-site clinic and your transparent PBM. You're a big fan. You said like it
Absolutely.
really made an impact. Is there any numbers that you can, show to even hammer that home even deeper? Like, are there any
Sure.
statistics or like what was the end result of enacting these transformations and strategies?
Well, going back to 2006, I don't know if you know, or those that know me know that I was a nurse by trade. So
Yep, my
undergraduates in
mom's a
nursing.
nurse, so love
That's awesome.
nurses.
Awesome. So, undergraduate in nursing and master's in HR. I started out as the occupational health nurse wellness director at Sargento and transitioned into my role, progressive through, the benefits world. And people would come up to me and want, oh, this hurts or that hurts, or I need this or that. And I'm like, oh, I can't do that anymore. So
Mhm.
that was really the impetus for the on-site health and wellness center is we needed to have resources on site that people could utilize. And it couldn't be me for obvious
Yep.
reasons. So that was, key. Then having that PBM and working through and getting those additional services, those ancillary services available, whether they be the phlebotomy or the PBM,
Mhm.
really was to help our employees make it easy, accessible, and affordable, all those things. And with that, we could hire people in a very rural area. When I
Mhm.
say rural, some of these towns, and I am a native of Wisconsin, born and raised here, and I'm pretty old. Some of these towns I never heard of before I started working at Sargento. They're
Yeah.
so rural. So being able to attract and retain the top talent to drive the business forward was our mission for our benefits mission. And we were able to do that with having an on-site health and wellness center. When the recruiters would tell them about the on-site health and wellness center, other than the fact that they thought we had a gym, which we did have a small gym in the basement, the
Uh-huh.
health and wellness center was really a clinic. And when they
Yeah.
found that out, they're like, oh, that was like, oh, you could see the light bulb going on. So it was
Because it
a,
shows you care about your employees.
oh, absolutely, totally aligned with the culture at Sargento.
Mhm.
Hire good people and treat them like family was our motto. And so this was a way to take care of our own, especially in a rural area without a lot of, choice in providers within the area. And then as a nurse, I always did population health management and wanted to make sure that we had the best outcomes possible. So I was data mining back in 1994, looking for trends so that we could develop programs around those trends. But from a perspective of PCPs,
Mhm.
we didn't have preventive care really in our plan before I started. And I wanted to bring that preventive coverage into the plan because as a nurse, prevention is key, right, to preventing stuff down the road. There were
Yep.
only about less than 30% of our employees that had a PCP before we started our on-site health and
And
wellness
that's
center.
pretty similar with just like statistics all across the country.
Right. Absolutely. But after we started it and we got people involved, whether
Mhm.
they utilized the on-site health and wellness center as their PCP or they were able to get a PCP through, connections through the on-site health and wellness center, which after a while was agnostic of the network, which was good.
Yep.
Then it went up to over 80%. And I was thrilled.
That's
So
tremendous. That beats the national average by well over double.
yeah, and because we made it easy, accessible, and affordable. Now we're in
Yep.
cheese, we're not in healthcare, but it made sense to keep building these out. And I literally did this proposal on the back of a napkin to the CEO at the time.
Mhm.
And now we acquired an organization a few years back, and they were begging for an on-site health and wellness center. And
Mhm.
I'm proud to say I went into it a couple of weeks ago, and it's beautiful.
Oh,
And
I
it's
love
just
that.
gorgeous.
You got to be so proud.
It warms my heart. It's
I
a
love it.
legacy thing, right?
And, I think in this space, everyone's always wondering, hey, if we invest today, are we actually going to get a return later? Did you see anything in the health data that allowed
Oh
you to
my,
provide better benefits for less money on average than some of your peers?
Oh, absolutely. And clearly those shock claims or those high cost claims, you're going to get them and they're going to blow your trend.
Yeah.
But clearly the amount of money that we save, because we'd always have our broker run the analysis of what it costs in the on-site health and wellness center versus what it would have cost under our
Yeah,
contracted
what's the
rates.
unit cost
Oh,
comparatively? That's where like the hard
millions.
savings is. And
Yes,
then you can look at downstream and everything else. But, I think you're
absolutely.
always looking at, all right, does it save me today? And by removing finance as a barrier, is that maybe allowing people to get the care they need today so that their condition doesn't exacerbate? You don't get a late stage diagnosis.
And
Later,
with
you
a
don't graduate into a more serious condition.
Absolutely. And with a very stable workforce, even though we were rural, our average length of service until we started exploding in growth was around 17 years,
Wow.
which is significant, right? So
Very.
you've got those individuals and you've got an opportunity to really make a difference in their life because you've got them. In some cases, we had grandmas, moms, and, kids. That three generations all working in the plants side by side. So
That's awesome. And when you save, on healthcare, that allows you to give your employees raises, promotions, hire more people, meaning better work-life balance, less workload per person. So,
absolutely.
when you work for a company that's really driving value and they're, saving, but also providing a better healthcare service, that usually ends up in more take-home pay, whether that is lower deductibles, lower premiums, raises, what have you. If your employer is losing a lot of money on their healthcare, you're feeling it in your paycheck, whether you realize it or not. So it's a
Absolutely
huge value driver.
right.
Last question I'll ask you, Sherri. What doesn't exist in health and benefits today that you wish did?
Well, what doesn't exist is really our biggest challenge, really, is we have a very broken, complicated, and very overpriced healthcare system in the US. So
How do we solve that in 4
oh
minutes?
my gosh, if I could solve that, I wouldn't be talking to you.
Oh, come
I would
on,
be on
Sherri.
an
That hurts my
island of
feelings.
Tahiti or something. I mean, oh no, Norm, I would always talk to you. That's a lie. No, I would be having my own organization, right, and helping others, which is really what I love to do. If there's any
And it's
nuggets
what you
that
have done for decades now.
help
So thank you
others.
for what you have done. Sometimes you can pass the torch.
Oh, absolutely. And that's my goal. But I wanted to just mention one thing. In addition to vendors, and you talk about the vendors that you can trust, I would really highly recommend joining a local or regional healthcare coalition. The
Yep.
networking and educational opportunities that you're able to gain through membership in a coalition is really worth its weight in gold. I've
Yeah.
met so many innovative benefit professionals through MBGH and the National Alliance of Healthcare
Yep.
Purchasers and sharing ideas, plan design options, contracting language, for instance, has really been a game changer. But there's always a new issue, so remaining involved is essential. You know,
Yep. And that's why I started Bending the Trend because, yes, MBGH members can all learn from each other. But what about the ones that are in the Northeast or the Southeast or in Texas or in California? Like, I want everyone to learn from everyone and everyone to have access to
right?
all this information. So when people hear your story about direct primary care and advanced primary care and on-site clinic,
Hmm.
like I want people from all over the country to be able to benefit from that,
Yeah,
not just your cohort of folks, in the Midwest where I come from too, being
right.
in Cleveland, Ohio.
Yeah,
So anyways, like that's the motivation. Thank you so much for joining us on Bending the Trend.
oh,
Thank you for
absolutely.
being a thought leader and, one of these brave souls that did some of these things before it was common knowledge. And really appreciate everything you've done to make this, just a better industry and motivating everyone to try to be like you. So thank you, Sherri.
Absolutely. Thank you for having me and put up the good fight. So
That's
keep doing
right.
it.
We're going to fight rising healthcare costs together, and our army keeps getting bigger and bigger. So one
Awesome.
person, one employer, one region at a time.
Together we can do it.
We can.
Together we
We
can.
can. Thank you, Sherri.
Thank you.
Thanks for watching Bending the Trend, where we are looking to fight rising healthcare costs. We are asking benefits leaders what digital health solutions they've implemented that has helped them bend the trend.